Hello? Okay. Hello? Magandang umagang Sunday po sa ating lahat. Ibig sabihin, mga ka-healthwise, ay linggo na naman po, Healthwise for Christ, Season 7 na tayo. Good morning, Light. Si Lights po ay nasa Manila ngayon. So, Season 7 na po tayo ngayon. Ibig sabihin, ito ay God's Children with Special Needs. Kaya po sa health-wise, ang health-wise ay kalusugang spiritual, ganun din po ang physical. Napakabuti sa atin ng Panginoon at tayo ay binayayaan ng mga guests, lights, ano? Hindi po natin makakasama si Kuya Ian at saka si Ate Jen kasi they're on a camp meeting together with Pastor Brian Tolentino this weekend. And we are hoping and we are praying that many souls will be blessed doon sa kanilang gagawing camp meeting. So, kami na lang po ngayon ni Lights ang mag-entertain o magbibigay sa inyo ng mga information. But don't worry po, marami po tayong guest na I know na magiging blessing sa bawat isa sa atin. So unahin po natin si Dr. Mitch at iimbitahin po niya ang ating mga guest. After a while, i-invitein ko din po ang ating mga guest chef, no? So meron din tayong mga guest chef ngayon. Okay, si Dr. Mitch.
Good morning, everyone.
Ay, good morning, Doc. Yan, batiin natin, Doc, kung may gusto kong batiin sa umagang ito.
Binabati ko po ang lahat ng mga taga-CA, Las Piñas Church, Adventist Church po natin doon, at syempre aking mga colleagues sa Adventist University of the Philippines, at the same way with the University of Perpetual Help Las Piñas. Welcome po for all of you. Stay tuned po kayo at marami po kayo matututunan sa health-wise.
Yan. Thank you, Doc Mitch. Atin mamaya na po yung ating special guest. Atin din pong invitein sa ating screen si Chef Shirley at saka si Love from Sydney, Australia. Ito po ay sister team. Sila po ang ating katuwang doon sa Australia. Hi, Ate Shirl. Hi, Love.
Hello.
Gusto niyo pong bumate?
Happy Sunday. Magandang umaga dito sa Sydney at lockdown kami. Pero okay lang. Thank you for the technology.
Yes. Meron po kayong gustong batiin.
Hello, good morning.
Siya po
nice
si
Love.
I'm sorry.
Love
Love.
Hernandez from Camarines Norte. In-invite ko po ang aking mga parents doon sa Basud Advent Institute. Hopefully sila ay manonood ngayon at nais ko rin pong i-invite yung co-teachers ng aking anak na sa ating si Belnor Calabina sa JAV sa Panganiban, Camarines Norte. Hello po sa inyo. Thank you very much.
Yan. Hello, magandang umaga po sa inyong lahat from Sydney. Atin din pong i-welcome si Dr. Damian, ang ating guest lecturer ngayon. Doc, gusto niyo pong bumati muna bago tayo mag-discuss?
Yes, I would like to say good morning to each and everyone. A blessed Sunday to all, and thank you for inviting me in the Healthwise for Christ program.
Thank you so much for giving us that chance and the opportunity, Doc. Alam ko po na very busy kayo, but in spite of your busyness, the Lord gave you for us today to be a blessing to many people. Sige po, si Light naman, bago tayo mag-start. Light, meron kang gustong batiin? Nagahang si Light. Okay. So, Light, may gusto kang batiin? Yan. Naintindihan niyo na po yun. Hindi po makasalita si Light kasi she's using iPhone lang. Hindi siya naka-laptop.
Hi,
Ayan na.
that community. Hello. Thank you for watching. And I hope you learn a lot from our lecture this morning.
Yan. Thank you, Light. Nice po naming batiin ang mga doctors and nurses sa Adventist Medical Center na talaga po namang ang kanilang task or ang kanilang commitment na maglingkod ay ganun-ganun na lamang. Mabuhay po kayong lahat dyan sa Adventist Medical Center. So atin pong pabatiin lang po natin yung first 10 viewers natin. Rocky, pwede nating kung saan, and then after a while mag-start na tayo. Wala akong list, Rocky, yung mga first 10. Okay? So, pasensya na po, dahil si Rocky ay hindi maganda yung kanyang internet connection. So, na lang po ako, yung mga nauna. So, welcome po yung mga nauna, no? I would like to greet them. Si Winston La Chica. Good morning, Winston. Si Sweetie Bueno. Pakilagay na lang po kung taga saan kayo para ating ma-welcome din yung mga tao doon sa inyong lugar. Si Kurt Buhia. I'm sorry, I'm only reading from the Facebook, doon po sa natin, FB. Si Bueno Honey, si Ryan, si Teresa Bigonya. Sino pa po? Yan. Welcome po kayong lahat. So without further ado, Doc Mitch, Ate Shirl, and Love, pwede na tayong mag-start with us, no? Ayan si Rocky. Rocky, would you like?
Yan, si Rocky.
Thank you, Lord! At nakasama namin si Rocky. Rocky, mag-greet ka ba? Yung first
Ayan.
few viewers?
Ayan, so good morning po sa ating mga ka-Healthwise family. So sorry po talaga, sobrang hirap ng connection ko ngayon. But yes, praise God po at marami pong nakaka-join sa atin. So yung mga top 10 greeters nga po natin ay 5 from our YouTube channel and also sa ating Facebook account. So yung mga na-screenshot ko po dito ay ang ating top 5 from YouTube account ay si Winston La Chica, Sweetie Bueno, Kurt Buhiya, Bueno Honey L, and Ryan Van Bueno po. Ayan, so ito po yung mga top 5 from our YouTube. And of course, yung sumunod naman po sa ating Facebook account ay si Romeo Barya, Frenny, Rachel Fiolog, Sito Anosan, and also, ayan, 1, 2, 3, 4, and Princess Daryl Dano. So ito po yung ating mga top 10. And message nyo lang po ang ating Healthwise for Christ na Facebook page at sila Ate Jen at Kuya Ian na po ang bahala. So, pasensya na po, wala po ngayon si Kuya Ian at si Ate Jen dahil po ongoing ang kanilang retreat o yung camp meeting po sa Mariposa at mahirap po talaga din yung connection doon. But praise God po at marami po tayo ngayon dito. So, I think ready na po yung ating magdi-discuss this morning.
Rocky.
So, since,
yes.
Doc, dalawa po kasi yung PowerPoint. So, ano po yung una doon?
Yung ADHD po. Yung ADHD with Dr. Damian. Yes.
Okay. So, magtatago na ba kami, Rocky?
I will introduce first our speaker.
Yeah. So, si Ate Shirley tsaka si Ate Love, standby muna at abangan nyo po ang kanilang imported cooking demo. Using local materials po yan. Don't worry. So, sige, Doc Mitch, would you like to introduce our speaker for today, our guest lecturer for today?
Okay, good morning, everyone. We are so blessed to have our first speaker for today. She's been a supervisor, education supervisor for 19 years, no? Since 19, ano pa to, mga kapatid, ilang taon na po siya nag-education supervisor sa DepEd, NCR, Department of Education in National Capital Region from 1987 to 2006. So almost 19 years na po siya na been exposed to special education in administration part. And of course, another thing, she's been 6 years po siya, no? 6 years as a special education teacher in Stafford County Schools, Stafford, Virginia, USA. Ayan po. And then she also educational evaluator sa Kiddos Tutorial and Therapy Center since 2012 until today. Yan. And of course, she's also a college professor in a graduate program in special education in the University of Perpetual Help and St. Joseph College in Quezon City, and of course, in Adventist University of the Philippines as one of our part-time instructor there. So we are so blessed to have her because of her expertise. And of course, she is also a proficient, modified, certified curriculum in intellectual disability, and also been creative, making instructional materials for special needs. And she's been handling special education for almost her life, no? Of course. And she
very
also
dedicated.
Yes, and she did her postgraduate licensure certificate in special education in University of Phoenix, University, USA, and with the specialization in mental retardation, emotional disturbance children, and learning disability from K to 12. So now we're so excited to hear from her. I know we will learn a lot from her expertise, from her degree that she did for almost her life. And of course, later on, I will introduce to you another speaker, which is he's a behavioral interventionist naman ito, no? Ang ating next speaker. So, mami ko po ipapakala sa inyo. So ngayon, let's give our attention and focus our hearts and mind to Dr. Aida Damian.
Okay.
Welcome, Dr. Damian. Take it away.
Good morning and a blessed Sunday to everyone. Before I'll go to my presentation, let me first take me off where the previous presenters had left. Dr. Lara has expounded excellently how children with disabilities are identified, diagnosed, using assessment tools focusing on ID, LD, ESD, Likewise, Dr. Collado and her body dwelt on the eating behaviors of ASD, starting off from the characteristic exhibited by ASD. Today, Dr. Nats Tangunan and I will troubleshoot you to the eating behaviors and how to manage this behavior exhibited by ADHD or children with attention deficit disorder. Okay. Then I will limit my presentation on who are these children, their behaviors, what are the causes, where do these children are categorized according to idea, and let's start with the presentation now. Okay. The first slide is children with attention deficit hyperactivity disorder, or in short, it is ADHD. What is ADHD? Okay. According to APA, or American Psychiatric Association, most common mental disorder among children. According to CDC, it is most common neurological dysfunction disorder. According to Mayo Clinic, it's a chronic behavior, and its S is a condition that affects behavior, or what we call the brain disorder. And we have the definition given by DSM-4. Okay, next. Are we now in the next slide? Okay. DSM-4. It is what you call a persistent pattern of inattention hyperactivity. Okay. It appears early in childhood, right? It is mentioned that there are six criteria of inattention and hyperactivity, a baseline on how an ADHD child is diagnosed. Okay. The occurrence should be early childhood, and this continues to adolescent or adulthood and improve. And in places such as school, work, or within the duration of 6 months. Therefore, there are things that we should bear in mind. ADHD is a childhood disorder, and it has a pattern according to the SM4, and it should continue from early childhood to age 16 until adulthood. Okay. Now, let me go to the Individual Disability Education Act, or IDEA. Okay. How are these children classified? These children with ADHD have no classification of itself. In other words, they are not categorized in the 13 categories of children with special needs as given by IDEA. So therefore, maybe ADHD is a condition that belongs to health impairment, or ADHD may be considered as a mental disorder according to APA. Okay. Or it may be under the umbrella of learning disability. Why did I say they are under the category umbrella of learning disorder? Because of their manifested behaviors in learning. One of which is inattention. Okay, if the child cannot pay attention, therefore he cannot learn. Okay, then how about, is it under the umbrella of autism? Of course, there are manifestations of behaviors of autism like with ADHD, and these are fidgeting. And fidgeting is also very common for children with autism. Now, how about emotional disturbance? Again, it is a disorder, according to APA, when this condition becomes chronic, and they may be as well admitted as a mental patient. Okay, let me give you my experience. as a teacher at the National Center for Mental Health. One of our patients is 5-year-old. She was diagnosed as ADHD. Okay, her behaviors is very are very hyper. She is hyperactive. Uh, she has bad mouthing. She cannot keep still, which is why she was confined at the National Center for Mental Health. Okay. Another patient which I encountered at the National Center for Mental Health is a child who doesn't walk, who doesn't know how to walk, but he knows how to run. Everything all around, he runs and run and run. And according to our psychiatrist, Dr. Galvez, he said, that this child is ADHD. Therefore, she was admitted at the National Center for Mental Health, where I was once a teacher there. So, we tried the program modification in order to limit his movement and his work from the entry or entrance of the Shangri-La Pavilion, where he was confined. We used a red perpendicular line to limit his movement. From there, from the door to the classroom, to the bathroom, to the dining room, everything was he was given, a red line to follow. Otherwise, he will be given some form of punishment, and this punishment is not physical, but what you call curtailing privileges. Okay, and it worked. So I considered as ADHD sometimes as emotional disturbance because we have two patients that I was able to handle. Okay, is it a behavioral disorder? According to research, some children with the ADHD displayed bipolar. When we say bipolar disorder, they have their mood swings, and they have ADHD have mood swing too. Do they have a repetitive behavior? Maybe, but if they are, then they may fall under children with autism. So these are the reasons why they need special education to address their learning needs. In other words, they are not under the category of children with special needs. However, they are eligible to have or to be in special education to address their learning needs. Okay. Therefore, if this will be so, then let's move on forward on the causes. What are the causes of this ADHD behavior? It says, according to research, there are two things, and one is familial, which is nature, or it is what you call very hereditary. If the first degree, or the mom or the dad, has ADHD, most likely the child will inherit that condition. Okay, so it is nature or hereditary. The other one is environment or nurture. When we say nurture, most likely the child is has a mother, and during that trimester, she smoked a lot, she drink a lot of alcohol, which might affect the baby or the fetus for the first 3 months. Okay. Now, so learning was messed up in school. See? She cannot keep still, she cannot sit down, he can't finish his work, he is very inattentive and hyperactive. Okay. So how about the behavior? The behavior, she interrupts, she blurts up, she screams. What is squirm? How about the social behavior? He has no friends. He has low self-esteem. he is really very isolated. How about the occurrence? Let's talk now about the occurrence. The above symptoms is given by DSM-5, which are indicators that the child has ADHD in the early stage of his life that may last until 16 years of age or even to adulthood. Do you know that there are also ADHD in adults which are undiagnosed? So perhaps if you have these behaviors which are exhibited by children with ADHD, then perhaps you are considered undiagnosed. The reason why you were able to reach that adulthood and still do not manifest this behavior now is because you were able to control it. Okay, so that's the keyword, control. All right, what are the types of ADHD? ADHD has the types like combined, wherein attention and hyperactivity, or ADHD predominantly inattentive. In other words, all the criteria of inattention are present with the child in accordance to the description of DSM 5. Okay. Then according to research, matter of occurrence which may have resulted in their uncontrollable early childhood behavior. Okay. So sometimes the reason why we are tackling the early eating behavior, I'm now on the early eating behavior of children with ADHD. They say, according to research, they overeat. Okay. They don't feel satisfaction until they throw up what they have eaten. According to research again, it is due to their brain dysfunction, which they know when not to stop eating, that resulted to obesity, which is why ADHD is under the umbrella of health impairment. Okay. They have no control of eating their food because they feel they have no satisfaction. They're always hungry, so they keep on eating, which may result to obesity. Okay. Now it says here also that one of the eating disorder of children with ADHD is the binge eating disorder or BED. Maybe my partner, Dr. Tangunan, will expound more on this, but I'm just giving you a brief preview of what this BED is all about. All right, this is a disorder displayed by ADHD. It is what you call the compulsive eating disorder, okay, which is displayed by patient with mental disorder. That is why, according to APA, ADHD is sometimes under the category of mental disorder. So I have said in my previous experience as a SPED teacher in the National Center of Mental Health, I have observed the condition of a 5-year-old child who is very hyperactive. Okay. And he is really a voracious eater, I tell you. She has no satisfaction. So which is why she is in mental hospital. Perhaps she's already that kind of chronic condition. And the mother could no longer control the behavior of the child, which wherein she tried to consult the psychiatrist, and the psychiatrist confine her in the hospital, and she stayed there for almost a year at the National Center for Mental Health. And the management that we have is pharmacology and giving her some lessons, because I was the one who taught her using the Montessori approach. And it's a little bit, she has some controlled behavior. Okay. So, what is BED according to Mayo Clinic? It is an eating disorder where people consume a large amount of food. They feel unable to stop eating. They overeat, behavior and earn eating whenever eaters are out of control. They become regular occurrence, which may result to obesity. What are the symptoms of BED? They're eating a large amount of food with a specific amount of time over 2 hours. See that? Have you seen a person who eat a lot and spend time in eating for 2 hours? And those are some of the behaviors of children who had binge disorder or binge eating disorder, and one of which is child with ADHD. All right, as I continue, it is a feeling that eating behavior is out of control. Okay, it is acting over where eating wherein he is not also hungry. Okay, so he eats rapidly. He felt depressed. He frequently eat without or diet without possibly losing weight. So he eats and eat and eat. So if we consider ADHD as having that kind of behavior eating disorder, then there is also a need to manage that eating disorder. So BED, in short, or bench eating disorder, is determined on how often the episodes of binging occur during the week. So perhaps if we're going to manage it, we must have to find out how many times does the child eat, how many times that in a week, so that we can monitor the eating behavior. Okay. So why associated with ADHD? Again, as I've said, it is due to the symptoms displayed by ADHD, which is linked by psychiatric disorder, which is one of the definition given by APA. ADHD is a mental disorder. Is it a mental illness? Well, perhaps it is a condition that affects person uh, uh, in which display behavior mode and thinking. Or it may be a mild anxiety to severe depression, which is considered bipolar with some mode swing. Hence, ADHD has three symptoms: impulsivity, inattention, and hyperactivity. Okay, so is it an illness? Is ADHD an illness? I think for me, as an educator, it is a condition and it is treatable. If it is an illness, it is curable. Okay, so therefore, uh, how are we going then to manage the eating behavior of these children who has no control of their appetite? They eat a lot, they have no satisfaction, and they even eat for more than 2 hours. I guess those are some of the things that I can give you as the definition of ADHD, who they are, What are the causes? Why are they not under the umbrella of any of the 13 disabilities? And why are they still in the special education program? So I have given all the answers, and perhaps it's high time for my partner, Dr. Nats Tangunan, to give you how to manage the eating disorder of this kind of children, as this is our main topic in Christ Health Crisis program. Okay. Thank you very much for listening and have a good day.
Hi. Maraming salamat po, Dr. Damian. Napakaganda ng inyong lecture. Akala ko po doon pag sinabing ADHD, yung hyper lang. Ayun pala, it involves a lot. And thank you so much for that very clear and very lecture about ADHD. Very precise, very specific po. Hindi lang po pala yung pag sinabi mong hyper yung bata, na ADHD yan. Hindi po pala yun. Meron palang mga factors affecting that. And later on po, mag-ano rin tayo ng Q&A. Actually po, marami nang nagtatanong. Kasi sabi ni Doc, 2 hours overeating. My goodness. Doc Mitch, 'di ba? Nakakaano talaga, nakakagulat. So so si Doc Damian, please stay on po, Doc Damian. We're very sorry po kasi yung PowerPoint ay naglalag si Rocky, but praise God we are here na dire-diretso po. The PowerPoint can be done later on po, ano. So, Dr. Mitch, would you like to introduce Dr. Tangonan?
Alright.
Okay.
Siguro sana yung hindi ko naman sinabi slide 1, slide 2 kasi I write it up in such a way that they are being presented slide by slide. So it's up for the one who is presenting to catch up with me.
Yeah, opo. Kaya lang po talagang naglalag yung internet connection
Anyway,
ni
I have
Rocky.
explained every slide.
Opo.
Because I got
Yeah, that's
everything
very
done.
yes.
Thank you so much.
Ipa-flash po natin yan mamaya, Doc Damian.
Okay,
So,
yes.
Dr. Mitch, take it away.
Okay. Thank you so much, Dr. Damian. Now to
You're welcome.
explore more about the ADHD in relation to eating. Okay. Our speaker for the second speaker is a part-time graduate school professor at the University of Science and Technology of Southern Philippines and USTP Cagayan de Oro and Father Saturnino Orios University, Butuan City at handling master's degree program in special education. And he took his master's degree in special education at the University of Philippines, Manuel Quezon, and currently a candidate of Doctor of Philosophy in special education. Now, he took intensive advanced training on applied behavior analysis therapy beyond discrete trials and received a certification from the Professor of Florida Institute of Technology, Florida, USA in the year 2011. So it means to say, mga kapatid, is a certified applied behavior analysis or ABA specialist and has more than 2 decades of intensive practice as behavior therapist, program coordinator, case manager, SPED consultant, and program director. He conducted several seminars, trainings, and workshops for parents, teachers, and caregivers in the field of behavior management and modification in special education. And he is also the founder and executive program director of Intervention Center for Autism and related exceptionalities, or iCare, located in Cagayan de Oro, Butuan City, and Iligan City. All right, so let's welcome Mr. Renato Tangonan, our behavior intervention specialist for today. Ay, audio, Dr. Tangonan, wala pong audio.
Paki-unmute po.
Unmute
Paki-unmute
po.
po.
Okay.
Wala pa pong sound.
Hello?
Ayan, it's okay now.
Okay.
Okay na po.
I think nag-e-echo.
Mag-unmute po kaming lahat para
Okay. Hello? Can you hear?
Yes po, it's clear.
Okay. So thank you very much. This is a continuation of the slides from Dr. Damian about ADHD. So as what do you call that? As symptoms of ADHD, they are very hyperactive, uncontrollable emotions, appetite, or they are easily frustrated for some, and eating becomes their coping mechanism. And because of overeating, then they resulted into another disorder, which is the binge eating disorder. Okay, so because of these excessive patterns of caloric intake, binge eating disorder and obesity go hand in hand. So of course, if you eat a lot, what will happen? We will become obese, diba? And treatment of the disorder could be instrumental in decreasing rates of obesity and improving overall health. So if you notice, it's more complicated now because you have the ADHD condition and at the same time, there is this obesity again as a result of overeating. Okay, so in addition to the health risks associated with obesity, binge eating disorder is associated with anxiety disorders, affective disorders, substance abuse, and attention deficit hyperactivity disorder. So in fact, about 30% of individuals with binge eating disorder also have the history of ADHD. So there is a high prevalence that ADHD and binge eating disorder occur together. Binge eating disorder is newly defined disorder and the criteria is as follows. Okay, so binge eating disorder is a newly disorder defined and the criteria are follows. Eating a massive amount of food in a short period of time, like over a couple of hours, and this will be more than what the average person to eat. So with this span of very short time, they will be able to finish a lot of food. Remember, massive amount of food. So hindi lang siya isang plato. Okay, so that's too much. Okay, so while you're eating this, you feel out of control. Like you just can't stop eating. Grabe ang appetite because they keep on eating. As Dr. D said a while ago, that they eat for 2 hours. Diba? That's too much. So this is different from sitting on a special occasion and packing your stomach because the lechon or the foods on the table are super yummy. Okay, so if there's a celebration like Christmas, birthday parties, and New Year, and then you eat a lot on those occasions, so those are not considered binge eating disorder. Okay, so this eating behavior has to occur at least once a week for a period of 3 months. O say, take note of that. So it will occur at least once a week for a period of 3 months. Okay, so pero kung occasional lang, siguro okay lang yon. Also, while you are eating, you must have at least three of the following. You can must eat faster than normal. Okay, so the first thing is you eat faster than normal. So in just a span of seconds, siguro naubos na yung isang plato. Di ba? So another thing is you feel uncomfortably full. Of course, if you eat a lot, what will happen? Okay, you feel uncomfortably full. And then the next one is you eat large amount of food even though you are not really hungry. Okay, so grabe ang appetite that even though you are not hungry, you are still eating a lot. And then you have to eat alone because you're ashamed on how much you are eating. Okay, so the tendency is these children will eat alone in their room or in places that no one can see them. Why? Because they are ashamed that somebody can see them, that they eat that much. And then after that, you feel disgusted, depressed, or guilty. So after eating a lot, they feel depressed na or guilty. Na they have to say, why did I eat all of this? That's is too much. Okay? So on a severity scale, yeah, next slide please. On a severity scale, binge eating disorder is considered mild if you have 1 to 2 binge eating episodes in a week. So kung isa or dalawang eating episodes in a week, that is considered mild. Moderate if it happens 3 to 5 times binge eating episodes a week. Severe if it happens 8 to 13 times a week. And considered extreme if you have these episodes for at least 14 times a week. But what you need is 1 episode of binge eating a week for the period of 3 months to be considered having this disorder. So, isang beses lang sa isang linggo for a period of 3 months. Then that can be considered as you have this binge eating disorder. Okay, so what causes binge eating disorders? So there are a lot of factors that play into how someone develops this kind of disorder. But there has been research linking to the specific emotions that trigger the binge episodes in binge eating disorder or the BED. So binge eating disorder episodes have been shown to be triggered by sadness. Okay, so if you notice, when you are sad, di ba, you want to eat and eat. And when you are angry also, as well as when you are frustrated. So in fact, studies shows that anger and frustration were the strongest triggers than sadness and depression. So minsan, di ba, when we feel angry and frustrated. So what do? We use eating as a coping mechanism. In one study, frustration was broken down more specifically to be emotions like discouragement, guilt, irritation, inadequacy, and resentment, just to name a few. So if you notice, all these emotions tend to be associated with some kind of interpersonal interactions. And this is very important because one of the recommended treatment for binge eating disorder is the specific therapy called the interpersonal therapy. But regardless of the trigger and the emotions of binge eating disorder, you're unable to tolerate dealing with these negative emotions in a healthy way. And thus, eating becomes their coping mechanism. So when the triggers occur, what will they do? They eat and eat and eat. So eating may provide some temporary relief to what they are feeling, but it does not last that long because it quickly followed by guilt and shame. So after that, they immediately feel guilty on themselves. And it's no surprise with kids that people with beans on are the foods with high sugar and high fat foods. So those are the kinds of foods that they really want to eat. Those foods that contain high sugar or foods that high fat. Okay. So when they consume those foods, they feel good because they give spikes of energy. People don't just binge on the food like fruits or vegetables because they don't feel the same way. Diba? If you notice, those children who eat a lot rarely eat fruits or vegetables. They usually eat those high in sugar content or high in fatty foods. Another finding from research is that people with binge eating disorder are less emotionally aware of their feelings. And what that means is that you experience negative emotions and you can always link that emotion to a specific feeling. So take note that when we are dealing with ADHD, that's attention deficit hyperactivity disorder, we are dealing with their emotions as well. And to them, it's very difficult to control their emotions. That's one problem. For example, as far as emotions go, there are big differences between feeling insulted versus misunderstood or invalidated versus ignored. And all those negative feelings um, or emotions, these have different cause and significance, di ba? These feelings provide different cause also and the significance to the specific person. Now, how do we treat binge eating disorder? In fact, there is a treatment. And the main treatment of BED or binge eating disorder is the therapy with or without medication. But evidence-based treatment for binge eating disorder work best if combined with medication. So what are the therapies available? Okay, so cognitive behavior therapy. This kind of therapy addresses this binge eating disorder which resulting from over restricting your diet and over focusing on your body image. So the therapy encourages better eating behaviors and it works on your self image. Okay, so this kind specific kind of therapy link your eating behaviors into your self-image. So just like, oh look, if you eat that much, this will happen to your body. Something like that. There's another therapy called cognitive behavior therapy, guided self-help. This is a way to do this kind of therapy on your own without the help of the therapist. So there's a manual on this one, which is called The Overcoming Binge Eating by Christopher Fairburn. Yeah, it's a manual actually. This is very useful in helping you walk through the exercises in a similar way that the therapist would. Another one is the interpersonal therapy. This one helps you identify the negative emotions. Remember, kanina, eating is linked into uncontrollable emotions. And this eating becomes the coping mechanism. So this interpersonal therapy helps you Identify your negative emotions that you have stemming from a relationship. And the idea behind this is that you have these negative interactions that produce emotions that you have trouble coping with, and you use eating to cope. Diba? So in this therapy, the therapist can also recognize the difficulties you have with identifying the correct omissions. And then this treatment, of course, requires a therapist to guide you through it. And then the last one is the dialectical behavior therapy. The dialectical behavior therapy for binge eating disorder. Okay. Am I disconnected? Sorry. Am I disconnected? Can anyone confirm? No, okay. So, sorry, I'm using my phone as well. Okay, so in this dialectical behavior therapy for binge eating disorder, this therapy was developed for borderline personality disorder. And there are 4 models of this dialectical behavior therapy. It's a mindfulness, the distress, tolerance, emotion, regulation, interpersonal effectiveness. So this DBT, or the dialectical behavior therapy, really addresses the emotions that trigger the overeating and help you identify them. Okay, so with DBT, there's some overlap with interpersonal therapy, but it is less focused on feelings that come from your personal interactions with people. So because patients with ADHD exhibit similar neurological patterns, doctors are looking into drugs that are approved by the FDA to treat at the same time ADHD and binge eating disorder. And this kind of drug is called Vyvanse or Vyvanse. Okay, this is the proven medication to treat binge eating disorder as well as ADHD. But of course, don't just buy this in the drugstore. It is very important to seek medical treatment or to seek treatment from the medical doctors, specifically in the doses or in the proper use of this kind of treatment or drug. Okay, so thank you very much for listening.
Sa health-wise. Hindi ko marinig. Buksan mo ako.
Yes. Chef Lorna, we can hear you. Naka-unmute po yata kayo, Chef Lorna. Yan. Okay, yes,
Okay.
you can speak na po.
Okay, Dr. Mitch. Sorry kasi we're trying to run yung video no after a while. But napakaganda nung ating nung lecture ni Dr. Tangonan. Naku, nakakatuwa talaga na yung eating pattern ay really no sila pala yung talagang dapat tutukan ng mga parents natin, ng mga family members na merong ADHD. So, marami tayong mga tanong, hindi ko na alam kung paano natin 'to uumpisahan kasi si Rocky naglalag siya talaga. But, can we first, Doc Mitch, pwede nating i-play muna. I will try no na i-play coming from me here yung cooking demo, and then after
Okay.
that, we will go with the Q&A para lang
Yes
try
po.
natin na papasok yung cooking demo. Okay? So, Doc Damian, konting lang po, minutes, and we will try to play the video on the cooking demo. Okay, Ate Shirley, pwedeng Silang dalawa out.
Sabi mo, i-share niya to. Sabi mo, i-share niya.
Kanino?
Ano ba yun?
Kira.
Nagpe-play.
Okay, Ate Shirl, it's your turn.
Okay. Hello.
Si Shirley po, si
Hello.
Chef Shirley at saka si Love.
Hello, good morning.
Aba, ano yan dinner natin yan breakfast muna, pwede? Pwede breakfast muna ang anuhin natin. O, pwede rin tayo magsimula ng kung gusto ninyo.
Oo,
ng dinner muna.
Ate Shirley. Yeah, Ate Shirley, please go on kasi may yung mga internet connection natin ay hindi maganda.
Okay, okay. So itong ating ang dinner natin, very very simple. Ano lang 'yan? Yung green peas na frozen, iyon lang sa tubig, alisin ng frozen, that's fine. Pagkatapos lagyan mo ng hot water, ng salt, at i-blend mo siya, pero lagyan mo siya ng kung anong favorite yung herbs. Ako sa likod namin, meron akong celery, kaya kumuha lang ako ng a few sprig of herbs. Celery yan. Kaya inilagay ko at i-blend ko. At saka, yung gusto nyo lagyan ng pepper, pwede rin. Sabi ng kapatid ko, ate, ano itong ginawa mo? Sabi ko, yung green peas na soup. Ay, sabi niya, ang sarap niya. Yan. Kaya lagyan mo lang iyan ng fruits at saka mag-cut ka ng wholemeal bread. Kaya iyan ay pasok sa ating power plate. Okay.
So, ayan po. Napakasimple lang ng ginawa ni Chef Shirley at saka ni Love. Yung green peas lang po, frozen green peas, marami po tayong mabibili niyan dito sa Pilipinas. Blended lang po. Yes.
Kahit yung kanya, senyorita, pwede.
Ayan po, babalik ko po yung mga ingredients niya po. Ayan. So, sorry po talaga, our apology dahil po hindi maganda yung ating internet connection. Lahat po kami nag-pray to have this kind of internet na lahat makikita. So, kopyahin nyo na lang po, isulat nyo na lang po yung mga ingredients and then kung paano ginawa ni Chef.
Okay, yun nga pala, nilagyan ko yan ng few nuts kung wala kayo para maging creamy. Ngayon, kung wala, pwedeng a little bit of soy milk.
Yes. So, ayan po. Yan po, base po yan sa power plate natin. So, green peas, nuts, if you have, I think she used cashew nut po. Sa atin, pwede naman po tayo, kung meron tayo dito, mga peanuts, yung pine, yung sunflower, yung mga ganun po, pwede rin po yan. Ang cashew ay pwede rin po yan. Yung herb po, yung celery, kung hindi nyo type yung lasa ng celery, you can use basil or you can use cilantro. Basta meron po kayong herb, malasa po yan. Napakabango kung inyong gagamitin. Yes.
Kung titingnan mo yan, salt lang ang nilagay ko kasi kailangan walang mga additives, lalo na sa mga ADD, kailangan walang negative. Walang mga additives, kaya salt lang.
Yes,
pero
yan
very
po.
Tasty.
Very tasty. Kasi po, number 1, kaya ito po ay naging masarap. Number 1 po, ay meron kayong nuts at meron po kayong herbs na nagbibigay flavor. It enhances the flavor of the food. So, ayan po ang breakfast. Kung titingnan po natin, blended lang. Tapos, ang presentation ay very attractive. Yan, blended po. Kung wala kayong bullet, pwede rin pong osterizer. Yan, blender. So, nilagyan lang po ni Ate Shirley, ni Chef Shirley ng bread, wheat bread. Mapapansin po natin, hindi madami ang portioning ni Chef Shirley. Isang slice lang, divided into 4. na maganda yung kanyang pagkakat, tapos very colorful ang kanyang fruits. Opo, pero pansinin po ninyo, 3 klase ng fruits meron siya. So, pasok pa rin po, very healthy breakfast. So, we continue with the lunch. Ano naman tong lunch natin, Chef?
Okay, ang ating lunch ay lentil rice.
Yan.
Okay. Napakadali lang yan. Pwede, ako ginagamit ko yung can. Can na lang nila, mga half cup na can of lentils, 1 cup of rice. Kahit yung tira mong rice the day before, pwede na yun. Tapos onion lang. Onion na mga medium size. I-cut mo lang into pieces. A little bit of oil, isutay mo siya. Sutay mo. Once na talagang medyo a little bit brown, you can put the rice and the lentils together. And then you just mix it up and, for a while. And then lagyan mo siya ng soy sauce. Ang soy sauce kung ginagamit, tamari o kaya Bragg. But kung wala kayo, salt is enough.
Yes.
Very tasty na yan kasi ang nagbibigay ng sweet ang onion at saka ang very tasty din ang lentils. Pag pinagsama mo yung tatlong yan, masarap na yan. Kaya yan, tapos silagyan ko ng fruits at saka kaunting lettuce at saka may
tomato, may kamatis.
May kamatis.
Ayan.
Okay na yan.
Okay.
So, kung kompleto, pwede rin na yung talbos ng kamote, hiwain mo, isama mo na sa pagsasangag para meron ka ng vegetables.
So yung pong ating lentils, if you notice, yung brown po yan kasi there are many kinds of lentils. Meron siyang yellow, meron green, merong Pero si Chef Shirley po, ang ginamit niya ay brown. Now, kung meron po kayo mabibilan dito na i-boil yung hilaw pa, you can do it po mga 5 minutes, pwede na po yan.
Yes.
Madali pong lumambot yan. So, pag ibang kulay po kasi medyo malabsa, mushy yung lentils. Pero yung brown po kasi buo yan. So, you can mix it with the rice actually. Yan.
Pero, Chef, nag-try ako ng munggo. Medyo tinuyo ko lamang yung munggo. Pwede rin. Ang sarap din.
Yan. Why lentils po? Because it's legume. It's part of our power plate. So, kahit wala silang ulam, meron na po silang legume. Yan, pwede na po yan. Plus the greens. Kung ano pong meron kayong greens. Kung meron kayong kamatis, kung meron kayong kangkong na in-slice lang, okay na po yan. Yan. Very simple po, di ba?
Yes.
Kahit na marami ang kainin nila, Doc Damian, mabigat sa tiyan to at very healthy. Okay, so power plate pa rin po. So for the dinner,
yan ang ating
ganda naman
dinner,
yan.
yan ang ating breakfast.
This is the breakfast. Okay, pwede rin naman pong pagbalik na rin kasi nasa sa inyo yan kung how would you do it kung may mga oras kayo. Okay. So,
yan
Ate Cheryl?
naman, meron tayong green. Ang ilagay ko dyan is spinach, pero pwedeng talbos ng kamote. Okay?
Okay.
Kung meron tayong blueberries, kung wala, pwedeng mango. Okay? Pero, tapos yung banana, at saka yung Weet-Bix, kasi dito available ang Weet-Bix. Kung wala sa atin, alam mo ba yung gardenia na bread?
Yes.
Yan, pwede mo na siyang gawin at i-blend mo lang siya with the soy milk. At yan ay masarap. Pasok yan sa power plate yan, lahat na yan.
Okay. Anahin ko lang po yung ingredients natin for this smoothie. Ang ginamit po ni Chef Shirley ay Weet-Bix. Sa atin po dito sa Pilipinas, pwede rin po yan kung gusto nyo cereals, corn cereals. So, kung meron kayong granola, pwede din po yan because that's part of the grain group. So, pwede rin po yan kasi ang Weet-Bix sa Australia ay it's a part of their breakfast meal. Anywhere, anytime, meron po sila niyan. Sa atin po dito sa Pilipinas, you can use cereals, yung corn cereals po, no? Hindi yung mga choco, yung mga ganon. It would be corn cereals. Corn cereals po, yan pwede. So meron po siyang banana, meron po tayong available na banana dito. May spinach din po tayo dito sa palengke. Yung blueberries po, kung wala po kayong blueberries, meron po tayong strawberry, no, na mabibili kahit saan, no? So meron po siyang soy milk. So meron po siyang konting nuts. So if you will notice po, yung nuts ni Chef Shirley, napakakonti po, hindi po yan madami. Few pieces if you will notice. Consumption within the day. Kasi meron siya ng dinner, meron siyang breakfast. So it's very few. Okay, play po natin.
Chef Lorna, kung wala talaga silang makuha na cereal, so raw oatmeal,
yes,
one handful.
Tama. Apo, rolled oats.
Yes.
Yan, napakaganda po, di ba? Yan lang ang iinumin nila, pero complete meal na po yan, mga ka-health-wise. Kasi meron siyang grain, meron siyang fruits, meron siyang vegetables, and meron siyang legumes. Yan.
Yan.
Ay, thank you, Lord, at napaandar natin. This is coming from me eh. Oo.
Okay. One minute lang pwede akong magano.
Sige po,
kasi,
Chef.
Kasi yung anak ko medyo magulo din eh. Medyo may ADHD din eh, nung maliit. Ang ginawa ko, tinanggal ko lahat ang aking mga pantry. Hindi ako nabili ng chocolate, hindi ako nabili ng biscuit, inalis ko lahat. At mga juices, kasi yung mga juices, at sinasabing no preservative, meron yung kaunti para maano. Ang ginawa ko, mga orange na lang kinakat ko with yun ang pinapakain ko. Alam mo, at saka water lang. Hanggang ngayon, hindi sila soft drinks. Alam mo, ang laki ng ibinait. Yun lang.
Doc, kaya naniniwala ko kay Dr. Damian tsaka kay Dr. Tangunan na ADHD is curable. Di po ba, Doc? Curable talaga siya. Based from the experience ni Chef Shirley, no? Inalis niya lahat yung mga nasa pantry niya. Nilagyan niya ng mga fresh. Yeah. Ate Shirley, I would like, I'm inviting you to show the power plate para makita ulit ng mga first-time viewers natin. Meron ka diyang ginawa na power plate, di ba? Meron ka? Can you share with us doon sa ano? Ayan, Doc Damian, kami po ay we are suggesting to follow a certain food group which is the power plate. This power plate is a program of the American Lifestyle Medicine Physician. Yan, ito po, Doc. So if you have the vegetable in your plate, may whole grain kayo, may legumes kayo, may fruits kayo, you are getting the full nutrient in one eating. So, ito po yung sinasuggest namin, Doc Damian, na to follow. It's very simple to follow. At saka, ang kagandahan lang po nito, ang suggestion po namin ni Chef Shirley, ay to present it in a way na very palatable, very attractive, pero may portioning po. And tasty. Pero may portion po, maliliit. No? Small bites, small portion.
Pero yun nga, pag nag-aano ko ng power plate dito sa Australia, talagang palagi kong i-incorporate nila ang 8 laws of health, pero may siya, 10 talents siya. Yan.
Yeah.
Exercise, nutrition, air, sunlight, water, rest, thankfulness, and service. If you incorporate this one in your food, we will achieve optimum health.
Thank you. Thank you, Chef Shirley. So, standby lang po tayo. And we are inviting Doc Michelle and Doc Tangonan to be with us as we go along with the Q&A. So, since hindi po tayo makakita doon sa hindi ma-flash ni Rocky, we will, we will read some of the question, no? Q&A po tayo, Doc Damian and Doc Tangonan. So, Doc Mitch, can I invite you over? Mga ka-health-wise, nais ko pong idagdag kung kayo po ang mga anak niyo ay naka-enroll doon sa mga school na may SPED, it is because of Dr. Damian. Siya po ang niyan, spearhead sa ating mga school na i-incorporate ang SPED sa learning activities o sa curriculum ng ating mga eskwelahan. Mabuhay ka, Doc Damian. For considering the special children in our society. Napakabuti niyo po. Okay? Doc Mitch, facilitate ng ating mga Q&A at ang dami-dami na nito.
Oo nga po, mga kapatid. I think may unang tanong dito. Sabi dito ay, what's the difference between bed eating disorder and bulimia? Yan.
Ano yung bulimia?
Ano daw pinagkaiba ng dalawa? Sir Renato Tangonan, I think it's related to your topic. If you have any answer for that.
Yeah, I'll take that, Dr. Miss. Yes.
Yes. Ay, ulitin ko yung tanong po, no? What is the difference between bulimia
may I check
and
first
bed
my mic?
disorder?
Can you hear me?
Yes, we can hear you.
Okay. So, bulimia,
Yes, you can speak now. Yes, we can hear you.
Go ahead, Doc. Go ahead, Dr. Tangonan. Go ahead.
Okay. So, bulimia and binge eating disorder,
Yes, you can
Nawawala
speak
po.
now. Nawawala yata siya.
Okay, sige po. Continue
It's
lang po.
okay. We can hear you. There's no delay from us.
Okay. So, bulimia and binge eating disorders are almost similar. Okay, both of the two disorders are fall into eating disorder. Okay. However, the difference is that in bulimia, after eating, the person use the compensatory behavior such as induced vomiting. Yeah. So, nagsusuka siya after kumain ng madami. Or in some cases, after kumain, mag-exercise yun siya ng heavy exercises para ma-burn niya yung kanyang kinain. Whereas in binge eating disorder, wala siyang gagawin at all. Siguro matulog na lang siya kasi full, di ba? So yun lang yung difference nilang dalawa.
May I add to that?
Yes, ma'am, doctor.
Okay, bulimia, according to this definition, is an emotional disorder involving distortion of body image and obsessive desire to lose weight, in which bouts of extreme overeating and followed by depression and self-induced vomiting, purging, or fasting. Okay, so that is the definition of bulimia. Okay, if we are going to take off on what I have said in the binge disorder, which is manifested by children with ADHD, these ADHD are not ashamed. They don't have guilt. However, these people who have bulimia, after eating too much, they vomit and they felt guilty. There is no guilt among children. However, for adults with bulimia, they felt guilty because they want to lose weight and they are ashamed of what they did. For ADHD, no, they don't feel ashamed.
So walang impact.
Walang impact. Dead ma.
Dead ma lang
Dead
sila.
na. Oo.
Opo.
So they keep on eating and eating.
That's
While bulimic
uncontrollable.
person eat and eat, and after that they throw up, and after that they try to what do you call that? After eating, throw it up, then they felt guilty of what they did. They're ashamed. So there's the guilt feeling. In this ADHD, no, they don't feel any guilt feeling.
Okay, mas good feeling pa sa ADHD yata ito kapag
Oo nga.
nakakain ng marami. Feel good.
Feel good.
Ayan,
Meron
oo.
po akong tanong, Doc Damian.
Yes.
Kasi po, dun sa, sa curriculum, which is integrated na po, lahat po ba nating school ay meron ng SPED program? If no, only selective, how would you, assess yung as Philippine setup yung school natin on this kind of special need ng mga batang ganito, yung mga may special need?
All right. Are you asking, let me paraphrase your question. Are you asking us is what kind of educational system we're offering special education?
Opo,
What
kung
kind
lahat
of
po ng
curriculum?
school natin sa Pilipinas ay integrated na ang SPED.
Yeah, it is already inclusive program, and there are still who are not following because of lack of personnel, lack of trained teachers, which is why another thing is that uh, there are children who could not be confined in an inclusive program because of the severity of their condition.
Yeah.
Okay,
Tama po.
so they cannot be integrated. In other words, they are in a self-contained classroom. One
So,
example is cerebral palsy
Mhm.
with severe condition. But I think here in United States, which I thought, what do you call that? Multiple disability. I am in a self-contained classroom. My kids do not go to inclusive program. So all alone, they are being taught in one classroom. They do not go from one classroom to another.
To another.
But in the
Yun,
Philippines, I guess I know one which is self-contained and it is in L cerebral palsy. All these children are confined in L cerebral palsy rehabilitation center, and that is one of the satellite school of the National Orthopedic School for Crippled Children, where again I was once a teacher in that center. That's why
thank you.
I know the setup. And also, hospital setup, I also taught in orthopedic school for crippled children, where we include ward teaching, what else? Because these children are confined in the hospital, so we go from one, we went from one ward to another. That is my experience at the National Orthopedic School for crippled children.
So may hospital setting din to, mga kapatid.
Yeah, there is a hospital
Oo.
setting. The
Not
reason
only in
why,
education setup.
because in the delivery of instruction in special education, we have what you call the cascade. And once the child met an accident while he is in a regular school, then she will be confined, or he will be confined in the hospital or for example, at the orthopedic school, orthopedic hospital, where there is a school
In
to let the child continue
the
his study.
study.
So therefore,
Even though in the
after his
hospital.
confinement and he was discharged, then an itinerant teacher will go to their house and teach the child until such time that she can go back to the mainstream.
Oh,
That
that's
is how
nice. Opo.
special education is all about in the Philippines, but others don't know
Yun nga po.
about our setup. We have the four
Yes.
national special schools. We have the Philippine School for the Deaf. We have the
Yes.
Philippine School for the Blind. We have the
Yes.
Cetavilla Memorial School, where there are satellite schools located in Metro Manila. One
Mm-mm.
is the Home for the Mentally Retarded, where I taught again.
Mm-mm.
Another is in the training school for boys, where that what do you call that? The children who committed crimes before their tender age are confined there. While they are being confined, they are being rehabilitated, and they are being educated at the Philippine National Training School for Boys. Therefore, there is no gap. While they are being rehabilitated, they also attend schooling. All the rest of this, what do you call that? These places where the DSWD is the one in charge of this. Like, for example, Catches Village, the
Yes.
Marina Hills for
Mm.
this the wayward teenagers are, the
Yeah.
teenage pregnancy. Then we have the Nainang Kabataan, wherein the children are abandoned. We have the Reception Study Center, where the pregnant women and the Marilac will go to the reception center, and we have also kindergarten classes. So the Josefa Belia Memorial School supplies ped teachers in those centers because we believe that rehabilitation and education should go together. So there's
Yun.
no way
Yun po talaga ang
that
maganda, 'di ba, Doc Mitch, na
Oo.
exclusive talaga sa
yes,
kanila. They are not hindi sila ihahalo doon sa mga normal na
hindi
Especially
muna.
for
Kasi
special
nakakonfine
needs.
sila because they are
Yeah.
severe, chronic.
severe case sila eh. Oo,
Yeah.
severe case.
Like for example, at the National Center for Mental Health, where I taught for 8 years, there are children there who are also, they have mental illness. We have the bipolar, we have the psychotic, and all those children are being confined there. While being confined and rehabilitated, there is a special education which we teachers are
In
doing.
charge. Oo.
Yes.
In
So after
teaching.
which, when they go home, they will be given a certificate of participation or attendance, and after which they can present this to their school and they can continue their schooling after
Yes.
they are being rehabilitated or
Oo,
after
yun,
their
Yun.
discharge from that hospital.
yun
And
po yung maganda, 'di ba?
we will
Oo.
also
Yeah, may
mainstreaming. All right.
yes. Oo.
Yes, there was also mainstreaming because I have
Yes.
said, remember the child who is very hyperactive.
Opo.
He does not know how to run, but we use behavior modification, after which he was mainstream to a regular school near
Yes.
Mandaluyong hospital, near the Mandaluyong Elementary School. And there are lots of schools around the vicinity of the National Center for Mental Health.
Yan, napakaganda nun, Doc, no? Doc Mitch and Doc Damian, na hindi lang, wag natin pababayaan yung mga members ng ating
Yes.
family na akala natin, or we're very, Chef Shirley, tuwan-tuwa tayo magpakain sa kanila. O sige, kain ka pa. Sige, hindi natin alam, meron na silang mga background as being ADHD. Kasi nga,
Yes.
sabi ni Doc, di ba, yung overeating, long time eating, talaga po naman, tapos we can see them. Napansin ko po yon since we started this. Now I realize yung mga iba po na autistic, matataba sila talaga, no? Kasi nga uncontrollable yung appetite nila. Tapos naaawa yung mga parents na pag hindi mo pinakain, 'di ba? Parang you feel so guilty. Na dapat po pala hindi kasi merong physical and mental na
Na effect talaga.
yan.
Yes.
Opo.
Kasama po yan kasi sa behavior yan.
Oo po. Chef Lorna, may isa pa tayong tanong.
Sige po, Doc
Oo,
Mitch.
sabi dito, what is the difference between autism and ADHD? Ayan.
Okay. Let me try to answer that, and I hope Dr. Tangunan will also add some of it because he too is a special education teacher. Okay, let's first go to ADHD. It appears in early childhood. Okay. While autism appears on about earlier than that, 18 months old.
Yes, 2 years old maybe,
After na
before
mga-
2.
Yan. All right. In ADHD, they talk a lot. They are verbal. While autism is non-verbal. That's one of their conditions. How about
Early.
behavior? They try to have some, what do you call that? Fidgeting, yan. Repetitive behavior,
Yes,
laughing. So those are children with autism. In other words, there are 3 conditions that we must have to know. First is autism is nonverbal. They have the triad of impairment, social, they isolate themselves. Although these children who are ADHD also isolate themselves. And the last one is social behavior. These children with ADHD can socialize. However, they are being rejected because of their behavior. So that is the difference of ADHD and autism.
Yun. So I will add on to what Dr. Daman said, no, kasi
Okay.
I was the one who in charge of autism last time na
Okay,
topic
yes.
natin.
Yes,
Oo.
Doc. Yeah.
I agree with what she said na before 2 years old, the indicators of autism are very evident already. And one way to most of the autism, the early detection is usually, like sabi ni Dr. Daman, yung early communication, they have lag, very delayed in communication. So usually walang verb, delayed sila. Usually mga 3 years old, hindi pa siya nakapagsalita ng complete sentence or
Yes.
for wala pa. So even though recognizing their own name, okay? And of course, another thing, social, no? They have difficulty sa autism building relationship, okay? Social.
Yes.
Ang ADHD baliktad, very vocal ang ADHD, opposite with that one, no? And of course, ADHD, it's a neurobiological based developmental disorder. May traits, may mga subtopics siya. We have ADD, attention deficit disorder. Pag sabi attention deficit disorder, clarification lang. Di ba po ang ADHD combined type, may hyper in attention. And ADD without hyperactivity. Attention deficit disorder only po siya. I remember I had a student before, she was looking at me, nagtuturo po ako. I thought she could understand what I'm saying. When I asked him, wala siyang naintindihan sa sinabi. Very basic lang
Wala
po.
sa focus. Yeah.
Wala sa focus. You know why? Why? What happened? Why you didn't know anything? Ang sabi niya, Ma'am, I was distracted with the tricycle
Yung
the tricycle
sound.
sound. No?
Yeah.
Kasi may nagpapa ng tricycle. So, nawala na siya. Distracted na siya. Wala niya naintindihan. Kaping ADHD naman po, mga kapatid, combined type, okay? Both na inattention and ADHD. Talaga hyperactive siya at the same time. Hindi siya hyper, nakupulang siya sa tapat ko. Pero, konting lang, na-distract na siya. So, yun naman pinagkaiba. So, marami pong pagkakaiba autism. And of course, we all know, sabi nga sa neuro research, kapag may autism, usually may comorbidities po siya.
Yes.
Most of them merong ADHD rin po na category, autism. May ganun siya, di ba? I mentioned that before. Kasama po siya. So, minsan nag-overlap din po yun. And ilan po question na? Ang daming tanong, pero siguro,
piliin na lang natin, Doc Mitch.
Last na lang siguro ito, no? Sabi dito, ang ADHD po ba ay namamana?
Yes, it is. It is hereditary. Hereditary.
Ayan.
So kung hindi po sa magulang, doon pa sa mga
Yes. So thank you po, Dr. Dami, kasi nga you are one of the causes. There are no specific cause, but there are many indicators na pwede maging causes niya. It could be genetic, sabi na namamana siya, environmental, food, no? Ito yung
napakalaki ng
food,
factor ng
food additive, no? And syempre brain injury and environmental din kasama din po yan. So yan po yating mga kapatid, napaka-blessed po natin that we have Dr. Damian and Sir Renato Tangonan.
Yeah,
na talagang sa Sir Nats pala, nawala na si Sir Nats.
Yeah,
Sana po. Hindi na siya makapasok.
Siguro internet connection niya din.
Baka internet connection. Opo.
Yun po. At tandaan po natin, curable at saka treatable ang ADHD. Sabi po nila Dr. Damian. So don't lose hope. Andiyan po si Chef Shirley na nag-testify talaga na reverse, no?
Totoo po yan. The earlier detection, the early treatment, the better po. Pag late na po yung madetect, bawa high school na, may pag-asa pa rin, pero hindi ganun kabilis ang improvement pag late na talaga. Kaya the earlier, the better po. Because there are many multimodal management that we could offer na marami po. Yung nabagit po yung Dr. Damian kanina, ano yung mga multi-management na pwedeng gawin for them.
So, Doc, last question. Doc, kung kunwari po ba pakainin natin sila, no? Kasi sabi mo, at least 2 hours yung eating nila. So, nagiging emotional sila. Pengi pang pagkain. How do you deal with this family members naman? Dapat aware din sila kung anong gagawin nila, di po ba?
Siguro, yung kagaya na sinabi ni Dr. Tangunan, na dapat siguro pwede natin gumawa tayo ng mga therapy sa kanila. And siguro one of which is, I believe in behavior modification technique, which is one of the best technique whenever we are going to modify a behavior. And eating behavior disorder is eating disorder behavior among ADHD can be we can use behavior modification or therapy. Okay.
Opo.
So just like what we did when I am at mental hospital, we use behavior modification just to lessen the behavior of that child who does not know how to walk but to run.
Opo, nabigla nga ako, hindi siya marunong mag-walk, pero tumatakbo siya.
And we use
Meron palang cases na gano'n, ha?
Di
yes,
ba kakaiba?
Oo,
kakaiba
kakaiba
po,
talaga.
kakaiba. Yes.
Imagine nga yung eating 2 hours, meron palang gano'n, ano? Si
Ay,
Shirley.
Yeah, and that is one of the children that I handled when I was in mental hospital. He wants to eat and eat and eat and eat. She keeps on asking, but we
Pag hindi
cannot
po
give
binigyan,
we cannot give her
nagtatantrum.
because the doctor has ordered, do not give her food.
Okay.
Yun
So,
po.
titiisin na lang po talaga ng magulang na hindi talaga bibigyan. Tough love,
Oo.
Ma'am Mitch.
Ayan, tough love nga.
At
Yan
isang
yung
daan.
sabi, yes, yan yung binanggit ko last time.
Wala naman namamatay sa iyak, hindi ba?
Tama. Tama, Dok.
Kaya mo siya
Basta
mag-ipasahin.
walang available, okay lang.
Oh, which is
Yes,
I
we must
mentioned
be
last
firm.
time about
Firm
that.
lang
Opo,
tayo
yung,
in
opo.
what we're doing.
Yung sabi ni Dr. Damian last time, no, ay kanina papolo na yung PABA, no, sayang si Sir Nats Tangonan hindi makapasok, pero it's his expertise, no, but I mentioned that last time, yung ABC, antecedent, behavior, and consequence. Yan po ay isang core strategy ng ABA na very important din po yan. Na ginagamit din po sa ADHD yan. Na alamin mo yung cause nun, bakit siya ganun nagbibehave,
Yes.
pag behave siya, anong reinforcement mo, anong consequence, dapat consistent po yan. Last na po, Dr. Damian and Chef Lorna, Chef Shirley, no, may humabol dito kasi about policy ng Pilipinas ito. Batas to, Dr. Damian ha. Mukhang malaman din nila to eh. Why in the Philippines, the SPED is separate from regular class? Is there a law for the setup? May batas po ba daw? Ito from Lopez Ronze, ang tanong po nito from
Yeah,
Facebook.
even internationally, we have the law on IDEA, what we call Individual Disability Education Act. That's what we are following. There is a law. Why we are separating them? Just because we'd like them to confine with the curriculum, with the special trained teachers, so that their needs should be addressed. Otherwise, if we're going to let them be in a regular class without modifying
the support,
their learning behaviors, then no matter how good the teacher is, she will never be able to teach this kind of children. It should be a special education teacher who is trained to educate this kind of children. So they are very separated. Why do we separate them? Just because we'd like them to teach. Some we must have to modify the curriculum. We must have to make some modification. We must make some adaptation. And those are needed in special education.
Yes. Saka Dr. Damian, no, in addition din po sa binanggit Dr. Damian, in addition.
Or individualized, while in regular, it is not.
Yes.
Correct. Tama po
So,
yan.
in addition po, no, kay Miss Rons Lopez, tama po yun, yung sabi po ng Dr. Damian, separate po, yung talaga yung mga severe case na hindi kaya talaga sa inclusive education, sa regular talaga. At pag ang inclusive po natin education, ay may batas po tayo dyan. Pag sabi po inclusive, sa mga hindi po nakakaalam dyan, pag sabi niyo po natin inclusive, na sa regular po yung bata na may special needs. Kasabay po siya ng mga regular students. Pag sabing separate, self-contained, hiwalay po siya dun sa normal na regular school. Yan. Yung mga severe case, yun po, yung sabi ni Dr. Damian kanina, na before they go to the inclusive education, lahat naman ng bago may pag-asa, pero yung mga severe, ang doctor will determine kung kaya ba niya dun sa regular o hindi. Di ba, ma'am? Kung siya magdidetermine, ay hindi niya kaya talaga, so dito muna siya, self-contained siya. Ay kaya niya sa inclusive, stay sa inclusive. But it doesn't mean na nasa regular yung estudyante, hayaan na natin without support. They still need support from us. From the SPED specialists, from the therapists, may support pa rin kahit nasa regular para magkaroon ng collaboration, tulungan, no? From regular teachers, SPED teachers, and the mga therapists.
Yeah. Meron po tayong law. Na-confirm po yan ni Doc Mitch and ni Doc Damian.
We have the Magna Carta.
Yes.
Si Dr.
Yan po
Carla.
yung inano ni Doc
the
Damian
disabled
sa
youth
ating
leader.
curriculum sa Philippine setup. Meron po tayo niyan, mga kapatid.
We
Kaya po
have lost.
kailangan talaga. Opo. Napakaganda po ng usapan natin at very thankful ng ating mga followers for the informative lecture ni Dr. Damian. Naliwanagan sila ngayon, no? Yung curriculum ng mga schools at kung paano i-handle na akala nila hyperactive lang yung mga anak nila is okay hanggang sa lumaki na. So meron po tayong mga natutunan tungkol dyan kay Dr. Tangonan at kay Chef Shirley kung paano natin sila bibigyan ng pagkain na masustansya naman, no? Pero may tough love na hindi natin bibigyan ng no? Kahit na very simple, very healthy naman po ang ating binibigay. So no sugar, ang ating pong sa mga ADHD, no carbs, yung i-lessen ng carbs, no? So yung mga sweets, yan po, nakaka-trigger, yan talaga.
Chocolate. Yan, mga chocolate.
Yes.
Yun nga
Delete natin yan.
Yun nga palang mga juices. Sabi nung kaibigan ko, yan na niya, Shirley, nakalagay no preservative. Pero dito sa Australia, nakalagay 2%. Pag ibinaba mo ng 1%, ay consider as no preservative. Kaya meron yan.
Oo.
So meron pa rin. Maganda kung fresh talaga fresh squeeze
talaga.
fresh
na lang po.
Natural yun. Walang preservative talaga.
Ay, magkano lang, di ba? Ang mga prutas, you just slice it small, tapos ilagay po sa magandang container, lagyan natin ng mga toothpick. Napakaganda po niya na no?
Attractive tingnan.
Yeah. So that's one way po na nai-reverse. Sabi nga po, sinasabi po natin, no? Again and again, treatable po, curable po ang ADHD. Wag po tayo we just na dun lang tayo kasi ganun sila. Hindi po. Treatable po sila at curable with the support ng family and with the specialist. Yan.
Sabi
Pero
nga
po kayong
alright, sabi nga
Yes,
po
Doc.
ang mga ADHD daw ay napapabilang din sa mga gifted but they are underachiever. Why? Because of their inattention. Because of their hyperactivity and impulsibility. Yan po yung mga dahilan kung bakit they are underachiever. But then, another theory about that ADHD is that they are bright, they are they have super IQ. However, there are times that the teacher who handle those children are not really feeding their mind correctly. In other words, the program is not fitted for them. I don't want. I have a grandchild. He said to his teacher, "Teacher, we took that up already yesterday. I know that already." See? Nag-blurred siya because he says, I know that already. We took that up already. Why are you going to teach again?
You see?
If you have something like this, then you'll consider these children as some kind of behavior, most likely in an ADHD, wherein you were not able to feed their mind and they become underachiever.
Tama po. Hindi na mibigay yung needs, no? Specific needs nila.
Wrong program.
Yes.
Dapat
So,
if there is an ADHD class who is not going around, make sure that you have also a worksheet on hand so that if he is already finished, give it back. Give again another one. He's done because he's very fast. Give another one. Give another one until your subject is over. Then did he stood up? No. Did he stand up? No. Because he's busy. So that's one of the things that a teacher should do. If you have a child who looks like an ADHD child, then give a lot of activity. If he goes around, what are you going to do? He is a supervisor because he is already done with this activity. Then you let him be a monitor. Okay, you collect the papers. All right. If there are pieces of papers around, all right, pick those up so that he will be busy.
So, Doc, relate po ako dyan.
This his ADHD behavior.
Opo, relate po ako kasi yung bunso ko, Doc, nung elementary siya, sabi nung teacher, hyper daw, no? Hyper. So, lahat na doon siya ilalagay sa fruit. Pagka tatayo, tapos ilalagay naman siya sa gilid. After a while, doon naman siya sa likod. Parang yung bata, niligid niya na. Kasi yung teacher, hindi sila marunong ibigay yung need ng bata. Kasi may special need nga yung bata. Which is true yung sinabi ni Doc, bigyan mo ulit para hindi tumayo.
Oo,
di ba?
strategies. Oo.
Yeah. So,
Walang siya,
kailangan talaga ng mga teachers
bigyan
na
mo siya ulit.
ganyan.
Hanggang sa ano siya.
Hanggang mapagod.
Yung kanyang hyperactivity.
Oo, kasi hyper Yung energy niya, kailangan ilabas.
But then, natutulungan ng teacher.
Oo,
Yes.
Yun yung
same time.
di po
Double
ba, Dr.
purpose.
Damian?
Oo.
Yeah. So,
Chef
natutulungan.
Lorna, basahin ko dito yung appreciation message ng ating mga viewers
Okay,
natin
sige.
ngayon.
Last
Galing
na
kay
po, Doc.
galing kay Miss Marilyn Kinaw. Thank you so much po, mga doc. Napaka-informative po ng mga ADHD condition. Not an illness po ang aking natutunan. Eating
Yes.
2 hours po, ay akala ko ay okay lang pala na kumain ng matagal po. At lalo na, pag depressed ang tao, iba pala yung pagkain ng kain na. So ADHD early, na makita early, ay mahalaga at mahalagaan ng bata po in a right way. Thank you so much po. I'm so interested po pag sa health po ang pinag-uusapan po dito. Thank you so much. From Marilyn Kinaw. Yan,
Thank you,
papasalamat po siya.
Marilyn. Yan po, very appreciative ang ating mga follower, Dr. Damian. At ngayon lang nila nalaman yung totoong ADHD. Yan. So before we, I'm sorry po to say na hindi to ay makaka-picker wheel. Pero promise po next week, idodoble natin. Kasi nga po, sira yung ating internet connection. Marami pong naglalag. So before we end, magkakaroon po tayong any takeaway words from Dr. Damian muna, tapos at Chef Shirley, Doc Michelle, and then ako na po yung last. So, Doc Damian, do you have any takeaway po words for our
Yeah.
viewers?
Okay, I would like to thank the organizer for having this kind of forum. And I also would like to thank you for inviting me. And I was able to share with you my experiences as pet teacher, and which knows that I love this profession. Until now, I'm still teaching. I'm already 76, running 76. I'm still teaching special education. My children are trying to stop me from doing this already because I am already that age. I'm already in my senior years. Still, I said I can still share my experiences, and hopefully that I can still contribute to the betterment of special education in the Philippines as a DepEd supervisor, which I
Thank you,
will.
Doc.
Yeah. Then perhaps we have a lot of things to iron out in our special education. But there are already young generations who are coming in, like Doc Mitch and Dr. Tangunan. And they are my students in the graduate school, and they are one of the best students that I have.
The legacy will continue, Doc Damian.
Thank you, Dr.
Napakabuti
Damian.
po.
Ah,
Okay, si Ate Shirley. Ay, si Chef Shirley po. Any parting words?
okay, ang akin lamang, tayo may ulo, kanan, kamay, paa at paa, fruits, vegetable,
Yes.
legs,
Legumes.
at whole food, and nuts.
Yes.
Yan, importante.
And of course, you have to pray.
Yan.
Yan.
Napakasimple po niyan, left and right. Hand and left and right foot at saka feet and hands. Isipin lang. Very nice tip, the Chef Shirley. Thank you so much. And Doc Mitch, maybe we can ask, kung hindi siya may naka-audio naman si Doc Tangonan, we can ask him any parting words, Doc Tangonan?
Wala.
Sir
Wala.
Nats?
Okay.
Wala talaga.
Okay, Doc Mitch.
Yes, another Bible verse that I would like to share with you from Mark chapter 7, verses 32, and Mark 16, verse 20. And they brought to him a man who was deaf and had speech impediment, and they begged him to lay his hand on him. And taking him aside from the crowd privately, He put his fingers into his ears, and after spitting, touched his tongue, and looking up to heaven, and sighed and said to him, Ephatha, that is, be open. And his ears were opened, his tongue was released, and he spoke plainly. And Jesus charged them to tell no one. But the more he charged them, the more zealously they proclaimed it. So mga kapatid, napakalinaw. Now we have all the knowledge, we have all the information that we need. It's time for us to proclaim it and share this good news to other people around us. Katabi nyo sa jeepney, sa tricycle, pag may nakita kang special needs na binibuli, whatever you heard from us, share to others that they will have hope that God gave us from very beginning. Thank you so much and God bless you all.
Salamat po ng marami, and I would like to reiterate to everyone, ang SPED po, it is already a law sa ating pong school, no? Philippine school setup. So, yung pong may mga concern, yung mga anak nyo, members of the family, yung friends, ating pong irali yan na magkaroon tayo ng ganyang klaseng school, inclusive sa kanila, para po
Amen.
maging productive itong mga batang ito at hindi sila maging liability ng society at ng family. Yan po ang ating tatandaan. So, in behalf of Ate Ian, Ate Jen and Kuya Ian, salamat po ng marami, Doc Damian. Napakabuti niyo po sa amin. At Chef Shirley for
God bless po.
sharing with us, and Doc Mitch, magkita po tayo. And Dr. Tangonan, maraming salamat po sa inyong eating tips para sa ating mga ADHD. So mga ka-healthwise, we'll see you again on Sunday. And God bless po sa ating lahat. Thank you po, Doc Damian, Doc Mitch, Doc Chef Shirley.
Thank you, Doc
Bye
Damian.
po.
Yeah,
Chef
it's a
Shirley, thank you.
pleasure. Bye.